Hello and welcome everyone to AABN's 177th weekly webinar. I'm deeply honored to present myself before you as a humble representative of AABN. It's great to see you all online on a Sunday morning. Through these webinars, AABN just did not keep our entrepreneur community engaged, but also enabled to meet a range of inspiring people who can help shape your thoughts and ideas. AABN has been engaging you with the objective of helping you hit the refresh button on emerging trends on a range of topics. The AABN, as you all know, is an umbrella front of entrepreneurs from across the globe. We have an awesome speaker with fresh perspectives on health, well-being, and safety, a 360-degree view. Let us extend a very warm welcome to our eminent speaker, Dr. S. Diana, to this interactive session. In this fast-paced, overworked, and chronically stressed world, there is an increasing desire to live a more purposeful, fulfilling, and joyous life. This is evident in the growing number of people and businesses turning towards transformational life, health, and well-being in their attainment of meaning, growth, and change. Until recently, people's relationship with well-being was occasional and often perceived as a luxury rather than a necessity. However, in recent times, an individual's well-being is taken on an increasingly important role in assessing the quality of one's life. Well-being is just not about being physically fit and free from illnesses and diseases. It has a more profound meaning, one in which individuals require investment into specific methodologies of supportive techniques to balance their nutrition, fitness, mindfulness, continued learning, and self-care. This in turn enables one over time to attain a state of wellness in mind, body, emotion, and soul. A 360-degree approach to well-being helps you both helps both the physical and non-physical areas connect, allowing them to impact and influence one another, and thus create well-being that takes into consideration all aspects of balance of mind, body, emotion, and soul will help one in the pursuit of all-round well-being. It is fair to say that the human race has never been so preoccupied with health as it has been in the recent past. Let me extend a very warm welcome to our eminent guest speaker, Dr. Diana, to this interactive networking session. She will offer a plethora of clever tips, advice, and action plans to help people to be healthier. Dr. S. Diana is a distinguished immunohematology and blood transfusion expert in Pondicherry. She completed her MBA, MBBS, and MD degrees at the renowned Jawaharlal Nehru Institute of Postgraduate Medical Education and Research, JIPMER, in Puducherry, and also has an MBA in hospital management. She specializes in apheresis and stem cell transplant, HLA and solid organ transplant, platelet-rich plasma treatment, and has established papers in Indian Journal of Ophthalmology. She's a member of the State Board Transfusion Council, NBTC, Government of India. She's a nodal officer in blood cell of National Health Mission, Government of India. Dr. Diana is a state assessor for National Quality Assessment Standards, Government of India. Dr. Diana is a regular in the Awareness Circle, being a professional speaker herself. She goes around with a motive to create awareness and addresses university staffs, students, colleges, radio program on rail safety, etc. Dr. Diana is an efficient team player and has exceptional communication abilities, which are vital in managing IHA and ensuring safe transfusion. Currently, she is the Chief Medical Officer, Blood Center, Indira Gandhi Government General Hospital, Puducherry. Dr. Diana will welcome questions throughout the program as she discusses some of the do's and don'ts that she has learned. Before I wind up, let me once again extend a very warm welcome to all and reiterate that our AABN doors are always open to those who might want to strengthen our work with the suggestions. I also wish to place on record a deep commitment to work tirelessly as a team to carry forward our goals in a constructive, gratifying way. I believe today is going to be a day of learning for each one of us. Hope you have an engaging day that is beneficial for the future of your careers and the industry at large. I would also like to thank Mr. Sundararajan from the 1981 batch of chemical engineering for his support to connect us to Dr. Diana to make this happen today. Thank you, and over to you, Dr. Diana.
Thank you, sir. Am I audible? Is my audio clear?
Yes, ma'am, it's clear.
Okay. Very good morning, a beautiful morning to all the August gathering. Most of the audience, I guess, are very experienced experts in your own fields. And I feel very honored and to be present among such an esteemed gathering. At first, good morning, vanakkam, and bonjour, because I'm from Puducherry, French town. Uh, my motive of this talk is basically to create awareness in areas which are I feel are a little bit more ignored, as in like women health. I will be focusing more on women health, followed by a few points on lifestyle modification, pediatric health, and a few points about mental health, and of course my domain, blood transfusion. I would like to thank AABN and Gopi sir and all the organizers for giving me this opportunity, a platform to share my views, my knowledge, and to fulfill my aim of creating awareness. The first point I would like to say is most of allopathy or Western medicine focuses on treatment, therapeutic part, whereas in reality, the preventive part plays an equal role as much as the therapeutic part. So, preventive medicine in India, just like mental health, is much ignored compared to the Western countries. I think you all will agree with me. So I focus more towards preventive medicine, creating awareness in preventive medicine, because the common saying goes that health is wealth. So when you lose your health, when an individual loses their health, everything is lost. Basically, morbidity and mortality will cause significant loss to ourselves and to our family members, as well as economic loss, financial burden to the family members. So, when one is aware of the consequences of neglecting one's health, then obviously the person will start focusing on improving one's health. So, this is my overall view and my motive of to why am I even here presenting these topics. Most of these topics, everyone will be quite aware, but still, I would like to give a new perspective of preventive care. That is the point. And you can stop me at any point and you can ask me doubts. And if you want me to repeat anything. So I'll now share my PPT. Is my PPT visible?
Yes.
Okay.
Yes.
So we'll start with health, well-being, and safety, a 360-degree view. So my first topic is women health. As I already told, that's my main domain of interest because I feel women neglect their health on various scales, and there is a complete lack of awareness about the normal physiological changes that happen in a woman's body, and there is also equal negligence on the part of the family members. So before I begin my talk, I know majority of the audience are men, and so I request all the men present here to be more empathetic and more caring towards the health aspect of your family members, be it your mother, sister, your wife, your daughter, your granddaughter. Because unless everyone cares, women they don't care for themselves. So the family support also matters. So, WHO definition for health, health is not merely an absence of a disease or illness. That is what the actual definition is. So, just because somebody is free from any illness or disease doesn't mean they are healthy. It is a complete physical, mental, and social well being, and not merely the absence of a disease. So, we can see what are the factors which contribute to a health. So, happiness, a positive attitude, good sleep, plenty of water, good diet, exercise. We'll be going through this over and over again in the upcoming slides. So holistic health approach, that is what the 360 means. So it's not just physical wellness, it is also emotional wellness, how your mental health, how healthy you are in your emotions, how healthy you are in your mental health. Of course, your social circle, how much we interact with the people, our family, friends, everyone around us, and of course, spiritual health. So these are the pillars of a healthy person. So women I would like to put forth again, insist the point that women neglect their health at all stages, at all ages, because women are always under the constant pressure of proving and providing to the family members. So they neglect their health and it only worsens as they age. So, what are the common health issues women face? So, we know heart disease, breast cancer, ovarian, cervical cancers, all these gynecological issues, and depression and anxiety, mood swings, and the significant rise in autoimmune disorders. We are seeing for the past 10 years, there is a significant rise. And as equally, we do see fertility and pregnancy related issues in women. So in India, we can see what are the contributing factors: poor hygiene, multiple frequent pregnancies, as I said, anxiety, depression, menopause, insufficient diet, malnutrition, and childbearing. So these are the factors which will contribute at the various angles which we have to see a woman. So first thing is a woman undergoes various phases in her life. It's not just childhood and adulthood or old age. You cannot just categorize it like that. We have to categorize it as various stages, right from infancy, childhood, then the girl attains menarche, she attains puberty, and then she goes into adolescence phase, following which we know there is a huge competition in education, college, and job, and then comes marriage, then their adolescence health, and after marriage it is about fertility issues, getting pregnant, and once after pregnancy, postpartum period, and lactation, feeding the child, and it even worsens after that because completely they dedicate their time to family and to the child. So after that, it is a phase which goes towards menopause. So menopause followed by aging and the end, which is death. So what I would like to insist here is during each of this phase, there is a significant changes in a woman's body. I would like to underscore that because a woman's body undergoes significant change at all levels: physical, mental, emotional, hormonal, dietary changes, changes in the social circle. Even, in fact, after marriage, she leaves her family and enters completely into another family, which is different social circle. So we have to consider all these aspects when we talk about women's health. So it is not the same. That's what I'm trying to say here. Even every month, a woman's health, physically, physiologically, hormonally, changes. That is why mood swings, kind of anxiety, depression, all sorts of psychological changes in a woman happens even in a month. So that much of awareness when we have, then we will approach it in a right way. That will prevent majority of the fights or kind of disputes within any family. This is a point I would like to insist here. So mental health, nutrition and lifestyle, social support, then cultural and religious beliefs, especially in our country where we give a lot of importance to cultural and religious beliefs. Healthcare access is still a big question in India. Though even there is healthcare access, still there is a lot of stigma and taboo for a woman to reach to a doctor on various scales. For example, mental health. If a woman experiences any mental symptoms, she is afraid to open up even to the family members, leave alone going to the counselor. And even bad is any uterine problem or any gynecological problem, still is a big taboo. I see this very commonly even among educated women, doctors, lecturers, professors. I have seen quite educated women too who completely neglect all the gynecological symptoms just because they are shy to approach a doctor. It's a taboo. So we have to overcome all that and make sure we have good healthcare access. Of course, socioeconomic factors, gender based differences is there. As I said, hormonal factors and reproductive health. So when we take a woman into consideration, I think it's right time we all awake and come to the truth that hormones play a major role compared to a male in a female, and it frequently changes all through her life. As I said, that is the same points here, how we can support a woman. Now, these are the common problems a woman faces on a whole. If you see, definitely there is mental illness or some sort of changes psychologically, constant sadness, sometimes drug abuse or alcohol abuse, then change in eating habits, irregular sleep, after menopause bleeding, then hirsutism or unusual hair, decline in energy, mood swings, irritability, social withdrawal, suicidal thoughts. These are all signs of a poor health, which are frequently overlooked or which are ignored. Now I will start with the first phase, as I already told, menarche. Menarche is the onset of puberty. It is usually around 10 to 15 years for a girl. And we should first of all prepare the girl child, give them adequate awareness in schools as well as at home. Everything starts at home. So it is a role of the family members to be very supportive and educate the child regarding menarche and puberty, what is going to happen, and what is the next phase, and also some amount of sex education and awareness in the schools should be insisted and implemented upon. Now, following this, she will have menstrual bleeding every month, and that can be either normal, it can be healthy, or it can be excessive bleeding or frequent bleeding. So these are the common problems once menarche starts, the girl starts facing. And most of the time, these are ignored because, again, as I said, that the taboo kind of mentality. Then adolescent health is very important. How we teach them, give them awareness about all high risk behaviors and how to avoid them. Now, the menstrual pain itself is most of the time overlooked as a kind of emotional overreaction. And that's, I would like to add a point, like it's even gaslighting kind sometimes when the family members ignore the menstrual pain which the girl or the woman tells in the family. And trust me, it is severe, it is painful, and it has to be undergone every month. And so imagine it, a 14, 15-year-old girl undergoing it. So there will be nausea, abdominal pain, bloating, and acne all over the face, headache, mood swings. It continues till menopause. So these are the symptoms generally of menstrual pain. And if the girl tries to have, I mean, if the girl has associated other problems like endometriosis, these symptoms will be even more significant. So I would like to insist here, if you are observing a girl undergoing these symptoms in your family, seek a medical help immediately, OBG gynecologist, because the girl needs immediate attention, because a simple ultrasound or sonogram will find out what the problem is, and we can very well, pretty well treat it with analgesics and the appropriate treatment, if needed, hormonal therapy. So here I am showing you the picture of endometriosis, menstrual cramps, or vaginal bleeding, and if it is a married woman, she may undergo infertility, and the uterine cramps pain is severe. And when they say it is painful, please acknowledge it. And the other common gynecological problem, very common, we see is polycystic ovarian disease. These are cysts in the ovary. And there is a significant rise of PCOD among young females in India. The common reason is it is usually associated with the diabetes and hypothyroidism. So we say it is like a triad. When there is PCOD diagnosed, we have to rule out hypothyroidism and diabetes. And the contributing factor is familial history and obesity and children, the health of the child. Most of the children nowadays are sedentary with increased screen time, and there is obesity. So all these contribute to polycystic ovarian disease. In polycystic ovarian disease, there will be weight gain and there will be abnormal facial hair, bloating, loss of scalp hair, irregular periods, and more of fatigue and tiredness. With when the girl presents with all these symptoms, we have to rule out polycystic ovarian disease. Now going to the next phase, pregnancy. As I told you, I feel a woman is given a little bit more care during pregnancy and lactation, because there people are a little bit more aware, but still sadly in our field we still see from the remote parts of India, these villages, still these girls are not aware, they come only in labor pain. So more steps have to be taken for creating awareness. So we can see there is hormonal changes, smell change, that's why they vomit, and there is changes in the taste bud, nausea, food aversions, water retention, and there is weight gain and backaches. So a woman during pregnancy has to be given extra care for nutritional need because whatever she consumes, the fetus will take it. So folic acid and iron, we know it is a basic one which we give in pregnancy. Folic acid is for the neural development of the child, and iron is to overcome the anemia. I would like to insist here that more than 60 to 80% of Indian women, please note the numbers, 60 to 80% are they are anemic, which means their hemoglobin level is low. In India, it is very common, and that worsens during pregnancy. So, when a woman is anemic and she gets pregnant, the fetus will not be healthy and the baby will have low birth weight and it will affect the woman. Can anyone just guess what is the normal blood loss in a vaginal delivery and a cesarean section? Anybody? Hello?
No idea.
No idea. Okay, just any ml you can just guess. Okay, so in vaginal delivery, it is around 500 ml blood is getting lost. You can imagine 500 ml is quite significant number, and it is even higher in cesarean section. It is around 1200 to 1500 ml. So that much of blood loss is anticipated in pregnancy. So we have to prepare the woman with that much of iron supplements and nutritious food during pregnancy, anticipating the postnatal blood loss. And of course, calcium. Why? Because the baby's bones are formed from the mother's bones, calcium. So when you don't give adequate calcium during pregnancy, she will lose her bone density. So calcium and vitamin D is very important. Iodine again for the fetal brain development, and all the vitamins, folic acid, all the vitamins, everything have to be supplemented. A nutritious balanced diet along with a moderate exercise and supplements will ensure the safety and well-being of the mother and the child. Now coming to the postpartum period.
Can I ask one question?
Yes.
Regarding the supplementation, actually, we are
Yes.
following the tablet. I mean, giving the supposed in tablet form. I
Okay.
mean, why do we go in such a manner rather than using the natural method by introducing foods which are highly in that particular nutrient?
Yeah, this is a good question actually. But whatever food nutrients you take, the iron which you take in that should fulfill your daily requirement of iron. So when you take a tablet, like say ferrous sulfate tablet or something, it has 100 mg, at least 60 mg will have elemental iron which will get absorbed into your blood. Whereas to equate to that 60 mg, you have to have at least a plate full of red meat or a bowl full of greens. Like that, you have to take 4 to 5 times a day. I'm telling it in a calculation which will be easy for you to understand. So for all practical reasons, it is not possible to completely fulfill your daily iron requirement based on diet alone, especially during pregnancy and pediatric childhood period, because the requirement is very high during that time. So it is better to give a nutritional supplement, good balanced diet nutrition along with it, iron supplement. But in general, for a healthy individual who is not anemic, there is no need for any iron supplements. Generally, we don't require or we don't recommend any supplements on a whole. That is only for people who are deficient. So the reason is this, because based on diet alone, you cannot fulfill your requirement. Can I proceed?
Yeah, yes.
Yeah, okay. So next phase is the postpartum period. Here you can see, again, I feel this phase, the mother gets neglected, sort of. The focus goes more towards the child. Whole family is happy to see the child and they focus on the child. But in India, at least, the mother's health is not given importance at this phase. We can see what are the common problems. You see, most of the women, they are not given awareness about breastfeeding, how to breastfeed, what are the changes during breastfeeding. So they have reluctance or dislike to breast. They may have the infant's attachment to the breast. This will lead to anxiety and stress in the mother, and operative delivery is even bad, milk secretion, breast ailments. And apart from that, what are the psychosocial part? The mother has the role to immediately take care of the baby, and body image also. The woman's body changes during pregnancy, marital relationships, care of the baby immediately. So after once they go out from the hospital, they have to go and start cooking, take care of the family, house, infant needs, babies needs, house maintenance, needs of the other children. So all of these factors contribute in the postpartum period. So I would like to insist, if there is a woman in postpartum period, as much as how you care for the baby, give more importance to the mother, because the mother needs adequate rest. The mother needs a very nutritious diet, and the mother needs a lot of psychological support from the husband and the family members. She needs good sleep. Now we will see what happens when these are not given. So now this postnatal depression or postpartum depression, again, this is a very ignored topic completely in India. There is no awareness. If there is awareness, well, good. But in general, I have noticed this postpartum depression is again being neglected in India. The reason being, people, I said, they give focus, they do focus on the child rather than the mother. So the mother will start feeling anxious, exhausted, empty, and always crying. Always the mother will be in a very low mood, having sleep difficulties, insomnia, feeling scared of being alone, panic attacks, worrying excessively of the baby. Now, you can ask me how to differentiate this from the normal postnatal changes. Even in normal postnatal changes, a woman will undergo all these. But when the symptoms are very significant and bothering for more than 2 to 3 weeks, yes, it is a warning sign. It is a red flag. Immediately, we have to approach a nearby counselor, psychiatric counseling, or psychiatrist, or OBG, your obstetrician, because this needs attention, because there is a significant rise of suicidal rates in postnatal depression in India. So I would like to insist this point here. Now, some amount of pelvic floor strengthening exercises also should be given importance during postnatal period and also in menopause, because the pelvic floor muscles get weakened during pregnancy, and this will cause significant problems later. Now, last phase is, I told you, menopause. So again, menopause starts from around 40 itself. 40 to some women attain menopause in 55. But again, the awareness about menopause, the perimenopausal symptoms is completely lacking, very sadly. It is completely lacking among even highly educated women. Because the changes just is not the stopping of periods. It is the entire, as I told you, physically, physiologically, emotionally, hormonally, at various levels, there are changes. And this is a sudden storm, I would say, in a woman's life. And if she's not prepared, it's only going to worsen. So I'd like to highlight some of the symptoms in menopause. First thing will be irregular periods, vaginal dryness, periods of hot flushes. So the woman will start feeling hot flushes all over her face, her body, and she'll start sweating. And changes in the breasts and night sweats, increase in sleep problems, headache, weight gain, because as a woman, as she starts crossing her 40 due to hormonal changes, she starts gaining more weight, significant mood changes, hair loss and dry skin and memory problems. So the same whatever I told you, and gynecological problems happen, and again they feel shy. They feel it is a taboo to approach even a female doctor. So even when I am sitting, even when a woman approaches me to come and tell some symptoms, she's so shy. She never opens up. I have to probe, and I will probe and ask. So what about your gynecological symptoms? They don't tell it, but it is important. Then they feel depressed, they feel stressed, and all the mood changes happen, night sweats happen. The reason I told you is the drop in estrogen level. Estrogen is a female hormone, and it drops significantly after 40. So when it is sudden, your body starts changing. So just as I told you, in the perimenopausal period, what all we have to look for? We have to look out for excess of menstrual blood loss. That's called dysfunctional uterine bleeding. That's what we call it. It usually happens around that time. And especially if a woman had endometriosis or fibroid uterus, if they had it, they are at a higher risk for bleeding. So around menopausal time, there will be a significant increase in rise in bleeding. Now, what does that cause? Women have this taboo, and they do not approach a doctor, leading to constant, continuous blood loss. And finally, they land to the hospital with severe anemia. I have encountered many women with a hemoglobin of 2, hemoglobin of 3, and it is very sad because they have undergone severe blood loss to the level of the hemoglobin dropping to 2 to 3. When I ask, they give a history. Yes, I did have a blood loss for 1 year. So, and then I ask, why didn't you approach a doctor? Why didn't you ask? And they are shy. So unless the family member asks, are you okay? How is your menstrual blood? Are you experiencing a lot of blood loss? Are you tired? Do you feel abnormal? They will not tell it. So it's the duty of the men in the family to come forward and inquire about the woman's health, especially her menstrual health, and seek medical attention. When the man comes and supports, she may be more open to approach a doctor. And a simple ultrasound, nowadays everything is advanced, and a simple ultrasound will diagnose majority of the gynecological problems. And we can save the woman from going into severe blood loss and anemia. And the second important thing is all the bone changes in the perimenopausal period. So because of the drop in estrogen, the bone density starts falling down. So we can see that in practice, we do see women around 60 years, 1 in every 2 women undergoes a fracture. Can you believe it? 1 in every 2 women above the age of 60. It will be a very trivial fall, and still they present very commonly with the forearm fracture, pelvis fracture, and the bone is brittle. The bone totally gets, that's what we call it as osteoporosis. The bone starts getting porotic. And estrogen, when it drops, and perimenopausal period is a significant contributing factor for osteoporosis. So as I put in the pictures here, you can see significant back pain, changes in the spine, and bone breaks easily, as I told. And that's why you can notice women losing the height. So once they reach around 50, 60, they stop going down in the height. That's because of your spinal cord changes. And we can see then other factors which will contribute. There will be associated rheumatoid arthritis. As the menopause approaches, women are more prone for autoimmune disorders like rheumatoid arthritis and other changes like thyroid problems. All this will lead to bone changes. And the next, the other picture which I put here is osteoarthritis knee. Now, osteoarthritis is again a common rising problem in India. One contributing factor is the toilet, which has changed from the Indian toilets. The pattern has changed to the Western type of restrooms where we do not squat. And so that leads to changes in the knee. Osteoarthritis is common in both gender, but in women, there is earlier onset.
Big picture.
So these are the points I would like to insist. So what do we do about this? So in perimenopausal period, the woman has to be given more of calcium supplements, dietary calcium, increase your dietary calcium, have a very active exercise, do good physical activities, and keep the blood circulation to your bone and muscles good so that you do not lose your bone later. Another common symptom which is associated with the menopausal perimenopausal period is frequent urinary infection and bladder infection. That's what we call cystitis. So they can see the changes in the urine color, frequent urination, and then they can have fever on and off. Now we are seeing a significant rise of cystitis among women and men too because of associated diabetes. So diabetes causes an increase in tendency towards infections. So cystitis is again a bothering symptom, and they literally cry with the burning sensation when they pass urine. And if the woman is also a diabetic, it spreads. The infection just spreads from the bladder. It sometimes goes up to the kidneys too. So do not ignore any of these symptoms, especially if you're in a perimenopausal period. If you're having burning micturition, if you're having some kind of lower abdominal pain frequently with a low-grade fever, you may be suffering from a cystitis or a urinary infection or a genital tract infection. So do not ignore these symptoms and seek medical attention immediately. Next, a common problem, this happens throughout a woman's life, more towards this menopausal period and more towards pregnancy, is a thyroid imbalance. So when you compare a male and a female who is more prone for thyroid disorders in general, women are 10 times more prone. 10 times, 1:10 ratio, 10 times more prone for thyroid disorders compared to men. And yes, in practice, we are significantly seeing a lot of thyroid problems in our place itself. So what are the types of thyroid imbalance we'll have is hypothyroidism, where there is a lower functioning of the thyroid, and there is menstrual changes, lower heart rate, hair loss, and cold sensitivity with the dry skin. The exact opposite of the spectrum is the hyperthyroidism, where there is, increase in heart rate. Again, there will be menstrual symptoms. There will be sweating, fatigue, increase in body temperature, and increase in heart rate. So overall, when do you suspect a thyroid problem in a woman? When she says some menstrual imbalance, kind of like either frequency of periods or completely decrease in the frequency of periods, or prolonged duration of periods with heavy flow, or an abnormal decrease in flow. So we should inquire all these symptoms and frequent tiredness with a hair loss and weight gain. Yes, there can be a thyroid problem. So with that, I think I've covered all the common health issues in a women. Now I would like to go towards cancers in women, because again, awareness is lacking in this domain. The common cancers in women are breast, ovaries, uterus, cervical
One
cancer, and
second.
thyroid. Yes?
And, can I ask a question regarding the thyroid session?
Yes.
Actually, if the T3, T4, and TSH results are showing normal values,
Yes.
do that mean that particular person is having a normal thyroid function,
Not,
or it can vary at any point of time?
no, not necessarily. We have something called as subclinical hypothyroidism. And then there is a condition called euthyroid state, and still you can have all these symptoms. So the what to do next is you have free T3, free T4 type of investigation with the higher sensitivity towards thyroid levels, or you can repeat it after 6 months. So yeah, that's a good question. Just because somebody's thyroid levels are normal as per their laboratory values doesn't mean we can 100% rule out any thyroid imbalance. We cannot. Maybe we can have other investigations, like you can do ultrasound of the neck and find out any thyroid enlargement, nodule, or a thyroid goiter, or even a cancer in the thyroid. Even that stage, sometimes even the blood investigations may be normal.
Okay. Thank you.
Yes. So first, my topic is breast cancer. In India, sadly, we have a lot of deaths, increasing in number of deaths due to breast cancer. And one thing about breast cancer, it is one cancer which can be easily diagnosed at an earlier stage compared to all the internal cancers. Say, for example, gut cancer, intestinal cancer, stomach cancer, pancreatic cancers. So these are inside. So it is little difficult to diagnose them. Whereas breast cancer is external in the body, and it shows in any one of the symptoms. But why still women miss it? Why still there is a rise of number of breast cancers diagnosed in the later stages, leading to death? The reason again is ignorance, lack of awareness, and definitely avoiding the physician. They are shy because it is something to do with the breast. They feel it is shy and they should not, they just think, okay, it's some small, this is a small nodule, it is fine. Majority of the women diagnosed, they do notice the lump or the nodule earlier itself, but they do not say it. So even sometimes there may be a doctor in the family and still they may miss it. Here, I would like to suggest that all the men in the family, be it the father, husband, or son, brother, take time and sit with the women in your family and talk with them. They are more prone to open up to the husband, maybe. You can just talk with them and ask, are you okay? Are you noticing any abnormality? Examine and see, do you find anything abnormal? Please let me know at any point. We can proceed with that. Or if you have a family history of breast cancers, any first degree relative, like your sister or your maternal aunt or your paternal aunt, these are your first degree risk factors. If there is a risk factor running in your family, have a routine checkup for breast cancer screening. I will tell about it. Now we can see what are the factors contributing to breast cancer. Again, everywhere you go, you will see obesity. Not only here, in any topic we are going to go forward, we'll see only obesity, because obesity is the single main factor. Then alcohol and smoking, which is sadly rising in women in India. Hormonal changes as the age of the woman progresses. Again, there is more risk of cancers, diabetes, any exposure to radiation, and pregnancy. So, as I told you, definitely there will be some symptom of breast cancer. I'm sorry, the picture is a little bit not clear in this one. You can see either there will be first a lump in the breast. They will notice a lump, or there will be dimpling near the nipple area, and there will be pain, and there will be swelling in the breast with the changes in the skin or redness, sometimes a discharge in the nipple, changes in the texture of the breast, and nipple retraction or inversion. So these are all the symptoms of breast cancer. And if a woman notices these, immediately they have to approach a doctor and find out what it is. So now recently, a lot of importance is being given to breast self-examination. So even we give a lot of talks, we go and speak to students, and some of the non-medical people have joined with us. Some of my friends are doing it as a social service. They go to schools, colleges, and teach about breast self-examination, which is the first primary important step in diagnosing a breast cancer. And once they notice, they hide it. They do not tell it. So the better. If they tell it earlier, the better it is to cure them. Because breast cancer in stage 1 and to some degree in stage 2, you can have complete remission, which means you can become cancer free. Unlike these other cancers, still the medicine field is fighting to get a complete remission. Breast cancer is one among the cancers which, when diagnosed at an earlier stage, we can completely make the patient cancer free and give her a long life. So that's why I'm insisting this point here. So what are the things we can do to prevent breast cancer? Of course, eating healthy, exercise, limit any hormonal therapy, check your weight, because once you reach 40, you start gaining weight because of hormonal imbalance. So it's high time. That's the time when you check your exercise and good diet, limit alcohol, watch out for changes in the breast, limit pollution, and breastfeeding prevents breast cancer. And you have to take a mammogram. You can take a mammogram like once in 5 years, and you can do BRCA gene, BRCA gene 1, 2, which is a little bit costly investigation, but if you do have a high degree of breast cancer incidences among your family members, you can take a BRCA gene test, BRCA 1, 2. You can do mammogram. A simple ultrasound will do. You go to a nearby doctor, take an ultrasound of the breast, even a small lump or nodule will be diagnosed. One more symptom is you'll find a nodule in the axillary area, in your armpit. So when there is an axillary, in your armpit, if you find a nodule, that could be a lymph node which is positive from a breast cancer. So any of these symptoms that I have told now, please approach a doctor nearby. A simple ultrasound and an FNAC followed by that will save the patient. So what do we do actually? If somebody is diagnosed with breast cancer, we try to find the staging and treat accordingly. We remove the breast with the surgery and then we give chemotherapy. And once diagnosed at an early stage, it has promising outcome. So next is cervical cancer and human papilloma virus. Again, I would like to cover something about this. There is a rise of cervical cancer in India. So cervix is the opening towards uterus. Okay, so what does it have to do with the human papilloma virus? Human papilloma virus, when it causes a high incidence of cervical cancer among women. And what to do about that? You can actually do a pap smear testing. Pap smear testing, every time you go to a gynecologist, especially if you're 40 years and above, they will take a small smear from your gynecological part when they're examining from the cervix. It's called a pap smear. So pap smear can be done like once in every 5 years or once in a year. If you're really apprehensive about screening for a cancer, it is a very easily diagnosable test, very simple test. It's not even painful. The other preventive method is a vaccine. So this human papilloma virus, so we have discovered vaccine against the human papilloma virus. And now even the government of India recently is advocating this vaccine for adolescent girls. We can give it from the age of 12 to 18, 20. So this vaccine will prevent any human papilloma virus infection causing a cervical cancer. And in future, it will prevent the woman from acquiring a cervical cancer. Now, what if somebody is about 26 years? Yes, you can still take the vaccine in the dose of 1 month, 2 month, and 6th month. So it's 3 doses for a woman who's taking about 26 years. So I would like to insist that point that even cervical cancer can be prevented with a vaccine. And the last thing is interest. Yes.
Yeah, regarding the vaccine in the teenage stages,
Yes.
is that given in 3 doses or a single dose?
That's a teenage is a single dose.
Okay, and can you share the approximate cost for that?
Sorry, post?
I mean, the price of the vaccine?
The actual thing is the name of the vaccine or the price of the vaccine individually. I will not be in a position to advocate any name or because I'm not giving
No,
vaccine
just
to anyone.
asking a general costing for that.
Yes, you can approach your nearby whoever is a general practitioner or a pediatrician, and you can discuss about the vaccine options and the prices. There are different company names, so
Okay, no
we
problem.
usually
And
do not advocate any particular company or any name.
okay, and regarding the prevention or the protection, will that give a lifelong protection if it
It
is taken
gives,
in the teenagers?
yes, definitely it protects them on a vast scale. They definitely have a very much reduced risk of acquiring a cervical cancer throughout their life because it is associated with a viral infection. That is why.
Right. Okay. Thank you.
Yes. So the next part is uterine cancer and fibroids. So I didn't want to go too much into technical terms, but this picture will explain it. You can see there are fibroids, multiple fibroids at various levels, parts in a uterus. Many women commonly suffer from a fibroid uterus. Fibroid uterus per se, it is bothering only if it is bigger in size because it causes a lot of menstrual blood loss and anemia in women. But they do make the woman prone for carcinoma of the uterus. So all these gynecological cancers, what is the first leading clue to guess whether the woman is having? The first leading clue is having abnormal bleeding. So between their periods, if they get suddenly some bleed, it could be any of these cancers. And especially in a menopausal woman, once her menopause is over, she has attained menopause and she did not have any menstrual blood for the past 1 year. Suddenly she notices few drops of blood. That is called postmenopausal bleeding. Yes, postmenopausal bleeding, if somebody comes and tells you, it's an alarm we should immediately look into because all these cervical cancers, uterine cancers, this endometrial cancers, all these will usually present with that kind of a symptom of post-menopausal bleeding. Again, I'm insisting post-menopausal bleeding. If anyone known to you after menopause of almost minimum period of 1 year, if they are experiencing any periods or menstrual blood, it is not normal and kindly approach your gynecologist nearby immediately because that can be an early sign of carcinoma or cancer of the cervix, uterus, endometrium. And one point I would like to add here, carcinoma of the ovary is also very common, equally in women. And the one sad part in ovarian cancer, it is diagnosed usually at a later stage because unlike uterine cancers, it doesn't present with any much of symptoms. Because it is in the ovaries, it is diagnosed only at later stages. So apart from that, what are the other general problems a woman undergoes around menstrual cycles or around menopause? Generally, women gain more weight in the waist. So we generally calculate a person's risk for a cardiovascular disease based on the waist-hip ratio. So menopausal women have a tendency to gain weight around their waist. And another common thing in India here in our place, which we very commonly see among young women, older women, is vitamin D deficiency. And that leads to calcium deficiency. So vitamin D is naturally available from sunlight. Due to our lifestyle pattern, we travel in AC car, we sit inside the AC hall throughout our work. We do not get much exposure to sunlight and that leads to vitamin D deficiency. And because of vitamin D deficiency, there is a decrease in calcium because calcium gets absorbed along with the help of vitamin D. So when somebody is deficient with vitamin D, they will be having deficiency in calcium also and their bones will be brittle. And as I told in the previous videos, I forgot to mention, if a woman wants to screen herself to know whether she's having osteoporosis, whether her bones are weak, yes, you have DEXA scan, you have all this bone density scans available in a nearby orthopedic hospital. Please go and get it yourself. Find out what is the density of your bone, whether you're at a risk for a fracture, and get yourself vitamin D and calcium, serum calcium level, vitamins level, at least once in a year, especially when you're going towards menopause. And vitamin B12 deficiency is another common symptom which is frequently ignored. We see women usually tell, no, I'm feeling tired, always my body is aching, my muscles are paining, my bones are aching. So you can see they have all these symptoms and we tend to oversee them. Usually that is because of all these micronutrients deficiency, I have only highlighted only 2 vitamins because I didn't want to prolong the session. But generally there is multiple vitamin deficiency among women especially and children. So do not ignore the symptoms. So self-care is very important. That's what the main motive of me speaking here is self-care, especially for women. Have a very, be physically active, do some exercises, have a healthy, balanced diet. You always have an option, whether you can have healthy food or unhealthy food. Every time it is your choice. And you definitely need a lot of self-love. Women have to take care of themselves. Unless you take care of yourself, nobody is going to take care of you. So the women are the basic foundation in a family. So when they lose their health, the entire family suffers. So it's high time women get that awareness and take self-love. Family support, very important. And peer groups, women should join with other women and have all these activities, physical activities, and awareness about breast cancers. Speak with each other, talk out with your friends, take activities together, and support other women too. So I go to the next topic now. That's a lifestyle modification. So from now on, all the topics, I won't be going very much into the depth because these are very common topics. So I just covering the superficial part. So lifestyle modification, I like to say it is not just diet, because many parts, I mean, many times the importance is given only to diet and exercise. The main elephant in the room is sleep. Many people ignore sleep. So you can see here nutrition, exercise, and the third picture is sleep. Sleep plays a very important role in lifestyle modification of an individual, avoiding all risky substances, reducing stress, and family and social networking. So first problem we are facing, very common in India, is obesity. So obesity, if you want to know whether you are obese, suppose somebody attending this talk wants to know you're obese, you can calculate your body mass index and compare it with the scale that I've put here. BMI calculation can be done. BMI calculator is there in Google. Why don't you check your weight? Why don't you check your height? When was the last time anybody checked your weight? I hope you're all checking it frequently. Check your height and you calculate your BMI. It will give an idea about where do you stand in the spectrum of obesity. So sadly, we are seeing a rise in obesity among children, adolescents, young people in India. And definitely we know it is because of sedentary lifestyle and more screen time. And obesity is the root cause. It causes other factors like high blood pressure, obesity related problems. So the other day I had a blood donor who was only 23 years old and his weight was 120 kgs. I was very much surprised at the amount of ignorance this person is having. He is only 23 years old. And I took some time and I spoke to him. I gave him some awareness. And when I saw the BP, blood pressure of the donor, I was expecting some amount of rise. He was having around 150 by 100, which is quite high for his age. Obesity, when somebody is obese, they are prone for having a higher blood pressure. So coming to healthy lifestyle, we can see the complete contrast on the left side and the right side. Majority of the people taking junk food, fried food, more of sedentary lifestyle, like a couch potato. You always sit and watch TV and shows and screen time. And then we have all this bad habits like smoking, alcohol, and unhealthy heart, not having enough sleep, more of sedentary, boring life, and of course, car. So these are the reasons which are contributing to the unhealthy lifestyle. In contrast, we can see on the other side, having a healthy food, steamed food, and increasing your brain activity with intellectual activities. These are proved studies. When somebody has frequent intellectual activities like solving a Sudoku, playing chess, doing a painting or an art, has a lesser risk of developing Alzheimer's disease. So here I would like to insist a point. Anyone who is above 40, 50, go out, exercise, meet your friends, and do some mental, intellectual activity, read books, because that will reduce your chances of developing Alzheimer's disease. And of course, fitness, healthy heart, having enough sleep, traveling, and active lifestyle. So whatever is possible, we can implement. So one point I would like to add here is the method of preparing food. Fast foods and all the recent fast pace of life, keeping the flame high and frying the foods, having burnt food and having barbecue food, steamed burnt food with a lot of spices, excess of oil, these kind of food are unhealthy. So in contrast, you can see foods which are steamed, boiled, these are much better and healthier. And also the utensils we use. So though they say Teflon coated non-stick vessels, they do not pose any risk. But when we use it with all the metal spoons and spatula, the Teflon gets mixed with our food, and it is prone to cause cancers and other health-related hormonal imbalance changes. That is why we can learn from our ancestors. When they used all iron vessels, different types of metals were used in those days. That is why now we are facing a lot of micronutrient deficiency in our food, magnesium, selenium, all these food, micronutrient deficiency, iron deficiency, and of course, using this RO water also causes some degree of micronutrient deficiency in our food. So we should balance it. We should supplement it with our diet. Again, your health, your choice. That's why I put this picture, the contrast. This obese man is standing on a rope, kind of on a asparagus, and he's deciding whether he's going to go towards green fibrous food or towards fast food. And when on seeing such fruits and vegetables, nuts, it's so pleasant on the eyes, is it not? Because nature, anything by nature is so pleasant to the mind and the eyes. When you see all these fresh vegetables and fruits, it is so much pleasant for the eyes. And it is your choice whether you want to avoid a pill or you're going to take all fruits and vegetables. So I just put a pyramid, like generally, how do you plan your diet? So you focus more towards more of proteins, lesser carbohydrates, and even lesser fats with restricted amounts of sweets and alcohol. There is nothing like a diabetic patient only should follow restricted diet. When somebody follows a diabetic diet at a younger age, they are more prone for a healthier life. See, what you take now, what food we take now, what care we take of our health will get reflected 5 years from now. So just because somebody is not a diabetic, say somebody is in their 30s, I'm not a diabetic, so I can take cakes, sweets. No, you try to imitate a diabetic diet, you will be having a lesser tendency to progress towards diabetes. So you can see more focus towards grains, beans, starch vegetables, fruits, fibrous diet, milk and meat for protein, and very less amount of sweets, fats, and alcohol. You can better avoid all this alcohol. So what is the point of a diet and an illness? Just I'm sharing with you. Say, for example, cancer. Say, for example, autoimmune disorder. Why does diet? Why do we always focus towards diet? Diet will determine your blood. So, and your immune system. So after years and years of research, more focus is going towards our immune system. So immune system means I'm telling about the WBCs. So when you have a healthy diet, when you're healthy, when you're generally fit, when you do good exercise and have a healthy diet, your immune system will be good, which means your cells will have the ability to destroy any infection or any cancerous cell. So cancer cells will happen at any moment in any part of our body at any age. So then what happens? Our T cells, our lymphocytes, our white blood cells, they will go and attack the cancer cells and prevent it from multiplying and developing into a cancer. So this is a link. There is a direct link between diet, exercise, good sleep, and your emotional well-being towards your tendency to develop any cancer or heart diseases, because the intermediate link is your immune system. So if you keep your immune system healthy through a good diet, then you're protecting yourself from cancers and other disorders. This is a well-balanced plate. You can see in your plate, you can have lots of non-starchy fiber, vegetables, green vegetables, then protein source, fish, and all this meat. Then you can have dietary fiber is very important. So a lot of videos are coming up now focusing on dietary fiber. Whatever food we are already having, you have it in moderation, that is more than enough. You need not suddenly drastically change all the diet patterns. And fruits and vegetables, they are very important because they contain a lot of antioxidants, so that will protect us. Now, benefits of a balanced diet is weight control, prevents illness, keeps you energized, and as I told, is boosts your immune system. And it's a and supports your heart health and provides important nutrients. So just a quick look into diabetes, hypertension, and heart disease. So first point is you have to lose your weight, reduce your salt intake, limit alcohol, move frequently, eat healthily, stop smoking. And your plate should have more of protein, fiber, and lesser of starch, carbohydrates. And you should have a healthy, balanced diet, exercise regularly, limit your salt intake, have frequent health checkups, check your heart status, just get an ECG done, take your lipid profile, see your sugars. There is nothing wrong in taking self-care and doing frequent investigations. And right now we have labs everywhere. We can just go out and there are labs easily accessible. Just get a blood test and know where your health stands. Types of exercises for diabetes, you can have resistant activities and high intensity. Before high intensity, kindly consult your physician whether you're fit for taking a high intensity. Simple one is walking. So ideally recommended is you can walk 3 days a week, and every walk session should be at least 1 hour. minimum. That if you keep it's a good pace actually. Cycling, swimming, and you can do mixed exercises. Dietary changes, weight management, regular exercise, stress management, and sleep. So these are the pillars of a good health. So all this diabetes, hypertension, obesity, where does this lead to? All this will eventually go and lead in one place, that is heart disease. So all these will finally affect your heart. So once you take, once you are aware and take you're in charge of your health, and you decide that I'm going to take good care of my health, my exercise, my diet, then you are preventing the risk for heart disease. So you should be physically active. You have to be free from stress. Stop smoking. Control your weight. So general formula to know your weight. There is usually a number of charts and all you can Google, but generally your height, whatever your height is, you minus 100 from that. Okay, that should be your weight. Say somebody is like 170. So their weight should be only 70. But this is not the exact number. If you want to know the exact number, there are charts you can Google and see your ideal weight for your age, and also ideal weight as per your activity. So whether you are mildly sedentary or moderate or moderately active, mildly active, moderately active, or you're very well active. So based on that, again, your what is your ideal weight? And please calculate your calorie intake. Everything is available in your phone. You can calculate, apps are there, or you can Google and see what is the amount of calories you should take in your diet to maintain your ideal weight. So please focus on your weight, and please focus on your waist weight, because Indians are more prone for a high waist hip ratio. Genetically, we tend to put more weight in our waist around our tummy. And Indians are more prone for heart diseases because our arteries, the blood vessels, they are much narrower compared to other races, Caucasians. So now they have found out that Indians are more at risk for diabetes and heart diseases because of these two main reasons. One is obesity, truncal obesity. So when you classify your body type, you can classify it as pear shape or apple shape. Apple shaped person, like shape of an apple, they'll have obesity on the upper half also. A pear shaped body is somebody who's having more obesity in the waist region around the abdomen. So most of the Indians we see, we have a pot belly, we have a belly in the waist region. So we are at a risk for obesity and diabetes leading to heart diseases. And genetically, our blood vessels are much narrower. So there is more chance for accumulation of cholesterol. And also our diet. So we take lots of carbohydrates in the form of rice and plenty of sweets. So this has to be watched out for. Eat a healthy diet, watch your fat intake, avoid fried foods. And we can see a rise in fast foods, a lot of barbecue, a lot of fast foods like burgers, pizza, all these are not good for health. Then you can avoid simple carbs. And here I would like to add a point. What do you think, which is much safer, whether artificial sweeteners are safer? Can anyone comment?
The next is survival of the fittest. Pro-nuclear family.
Can anyone comment about
That
artificial sweeteners?
They are not healthy.
They are not healthy. Yeah, good. Can you tell why?
Because they are in the refined form and it is unsaturated, I think.
So they have all the saccharin and aspartame. So these kind of substances are actually much dangerous than the actual white sugar. So what to do now? So try to take food with less sugar. It's just a practicing. It's just you have to practice little by little. So what does sugar actually cause to your body? Why do we always have the tendency to have a sweet tooth? Why do you think? What is the reason? Why do we always feel like, having a sweet, or at least I have the tendency. I always have that urge to have a sweet or a chocolate or a sweet drink. Why do you think? What is the reason?
What I read is, the brain is addicted to two things. One is sugar or a sweet. Then second is a drug. Yeah.
Yeah, exactly. So dopamine. So dopamine is that is a type of neurotransmitter in your brain. So there are a few types of neurotransmitters in your brain which will affect your mood. So once we take sugars, it increases our dopamine and we start feeling good. So there is a sugar spike. We feel very active and all that. After some time, the sugar falls down. So then you go for a sugar drop and start getting irritated. And again, you feel like having sugar. This is the reason why we are addicted to sugars, sugary substance, sweets, cakes, frequently having them. So how do you replace that dopamine? The same applies for your mobile addiction. Increase screen time. Why do we keep scrolling? There is in fact a term called as normophobia. People are scared to be quiet and normal in a place. Immediately we pick our phone. We are all like that. I'm not pointing at anyone. It includes me also. Sometime back when I was sitting in a bus stop and waiting for my friend, I was surprised to see some 20-30 people were around me in the bus stop. They were all youngsters, college students, and none of them spoke with each other. They did not even lift their face and talk to each other. Each of them were having the phone in the hand. So now they have even given the term as normophobia. Like when you're standing in a lift or when you're waiting for someone or you're traveling, immediately we are scared to have that normalcy around us. Immediately we pick the phone in the hand and watch more of phone. Why do you think that happens? Again, that is the same reason. Mobile phone causes increase in dopamine level in your brain and you feel fulfilled with that. That is the reason we don't get out of the couch, we don't exercise. But the alternate option is having a good exercise. When somebody has a good exercise, say for example, a simple walking. I'm not insisting on, heavy immediately hitting the gym and developing muscles, but I'm just insisting on a simple walk. When you have a simple, healthy walk, your blood supply to your brain and your heart and your muscles increases, and this will increase the dopamine in your brain. Then automatically you will stop using more of phone and eating sugars. So this point I wanted to explain why we are addicted to sugars and why we are finding difficult to stop sugar. Replace your sugar, replace your phone with exercise. Avoiding fried foods, avoiding simple carbs, eating fibers like fruits and vegetables. They are the nature's gift for fiber. When somebody has a good amount of fiber intake, that is very, very helpful for the gut. You're being very kind and your gut will thank you when you have good fibers, because fiber will increase your stool output and that will have a good gut health. And also when you fill your stomach with good fibers, you will have lesser propensity to have all this processed food. And better you have some mild boiled vegetables and fruits. Better to avoid having it raw, because even though we still have a lot of salad with the raw vegetables, raw fruits, still there is prone for infections. And then we are move on to
Doctor,
yes.
just one question actually.
Yes.
Even after having full meals, there is a
Yes.
tendency to eat something after that. After completing the meals, no, you have
Yes.
a tendency to munch something like some snacks and other
Desserts.
things. What is this feeling? I really fail to understand this actually. How we feel that we are unsatisfied even after full meals.
Yes. So that is the thing I told you, sir. Already you have wired your brain. You feel complete. Your dopamine gets more secreted when you have sugary things after your meal.
No, I'm not telling about sugar, madam. Actually,
Okay. So
even
what is the period? What is the gap immediately after your food? Do you feel like that or?
yeah, immediately after the food. That is something surprising.
Okay, so like snacks means chips or
Chips, muruku type of things.
if you really feel like a moderate quantity is fine, you can have one or two, but try to avoid that habit, because whatever food you have taken takes time for that food to get digested. So normal time for your gastric emptying, your stomach to empty the food is 2 to 3 hours. So before that time, again, when you add some more food, this will go and disrupt the digestion of the food, which is already in your stomach. So try to avoid that. And mindful eating. So what is mindful eating is you feel half full and you stop after that. And then you slowly eat after that. And instead of feeling full and then stopping, you can stop eating once you feel half full.
And another thing is actually there is a lot of confusion between whether fruits should be taken before your meals or after your meals.
In allopathy medicine, there is no particular explanation, sir, because in allopathy, it is like one size fit for all. But I beg to differ here, because we have to refer some of our ancestral food patterns when it comes to our diet, because we are not Westerners. We do not follow Western diet. So when we go a little bit into Ayurveda or Siddha or these kind of dietary practices, Ayurveda tells you should not have fruits along with your food, because fruits will ferment. No, so that kind of acidity will impair your normal food's digestion. Like suppose I have food now, my rice, and then after some time, maybe within 10-15 minutes, if I have a banana, now this banana will go inside and the digestion changes the pH in the stomach. So that will affect the banana will go inside and get fermented.
Putrefaction effect.
Yeah, fermentation. So that will cause some changes in your pH in your stomach, which is very vital for the food which you have consumed. So that will impair your food and it will cause indigestion and gassiness and bloated feel and flatulence. All this happens because of your improper method of taking food. These I referred from, I will tell, Indian dietetics and from Ayurveda. These are not very clearly given in Western medicine, because diet is to be catered and tailored for an individual. It is, you cannot generalize it. So I have read all this and I understood that our dietary pattern also matters. How you eat, what time you eat, and what you eat. So the ideal time to take any fruits in a day will be around after your breakfast, maybe around 11 o'clock, somewhere in between your breakfast and your lunch, where your digestion will be in peak. And whatever fruits you take, you should have good amount of absorbance of all the nutrients in a fruit. And it is better to avoid a multiple mixture of fruits, because each fruit has its own tendency. So you can take, maybe you are eating one banana, maybe you can have it with one more fruit. That's all. You don't have to mix all the fruits and have fruit salad. It is again a wrong combination because the factor of digestion. And regarding your doubt, you can take more of protein intake in your food, sir. You may feel less tendency for having a crunchy snacks after that. And you can have your blood sugar tested also. And the fruit combination, again, it's better to avoid fruits with milk, because milk will again get, when you take churned, when you have fruit and milk along with that, the fruit will get fermented and that will cause acidity in your stomach, which will affect the milk, and milk will like get converted, like churned in your stomach, and you will have all these sorts of bloatedness, gassiness, kind of lactose intolerance. So what type of food we take, at what time of the day we take, in what combination we take, and in what amount quantity we take is very important. And how many of us actually plan our meal? How many of us are very cautious of what we are eating? If majority of you are cautious and having a good diet, I appreciate you. But if you are not, at least take steps. There are simple apps, there are simple Google, you can just check and see. One drawback which I checked in Google is it is giving more of Western diets, avocado, oats. Most of the apps, most of the Google, they do not give Indian diet. So for somebody like me who's very comfortable with my own diet, I do not want to change it. So there is no particular diet plans available. You can read books on Indian dietetics and make your own plan, your own meals, and avoid this kind of last minute binging of food. And of course, we have to eat green. We have to eat fiber. We have to eat green, because greens, fruits and vegetables, they are very rich in antioxidants. Antioxidants
Sorry,
are very important.
One more question, doctor.
Yes.
Actually, this is some people are very staunch followers of vegan thing, where they, even in vegetables, they don't consume actually onion as well as garlic, or even some root vegetables, tubers also. You feel they will be deficient in something? They all follow actually Ahara Niyamam, the book written before 500 years, and still they follow the same thing.
There is a lot of mixed school of thought when it comes to veganism, which is very much in current trend now. Allopathy does not advocate veganism, because we know the significance of milk, calcium, and vitamin D, vitamin A. The very good source of all this is milk. Of course, protein. You get a good source from milk. So WHO and allopathy and all this, our Western medicine does not advocate veganism. And veganism has been now mixed up and confused with the sattvic diet. And maybe the book which you told, sir, is it about sattvic diet or is it about veganism? Because our Indian food, our sattvic system does not exclude milk and milk products, whereas veganism completely excludes milk and milk products. So I would, in my personal opinion, my personal view, I will never encourage anybody to go for vegan diet. Maybe a few cases who are lactose intolerant, that is entirely different. But if you have been consuming milk all through your life, milk, paneer, curd, there is even a lot of difference between paneer and cheese. How many of us are aware of the difference between paneer and cheese? Can anyone tell? Hello, can anyone
Paneer
tell?
is more of a little fermented.
No, sir. As a nutrient, as
I think it's processing.
no, not the method of making. Can you tell about the significance in our health? Which is better, healthier, and why?
I think paneer, because very few ingredients are used. You know, you just use milk and then something to.
Exactly. So paneer is one reason, as you told, ma'am. It's not much processed like cheese, but paneer they did a lot of studies comparing paneer and cheese, and they found paneer to be a miracle actually, because paneer has lower levels of bad cholesterol compared to cheese, and paneer has a higher amount of protein when compared to cheese. So even now, the Westerners are moving towards paneer, ironically, because now they've understood it is a good source of protein with a lesser risk. You cannot have that much of cheese as you can have paneer, but still you need moderation. But here I'm insisting the difference between paneer and cheese. See, even the small things, no, they make a lot of difference. What ingredients you
Yes.
add in your food, and what quantity you're adding, and how you're cooking it. How are you preparing it? And what is the time period between cooking it and having it? What time of the day are you having it? So I don't want to go too much elaborate into diet section, because then it will go too deep, because this
Yeah.
is my field of interest. I'm very much interested in talking about different types of diets, Indian diets, because I am so interested in Indian diets. I would not comment about oats, avocado, strawberries. A normal Indian man who's working as a daily laborer, do you think he'll be able to afford strawberries? No. So I always try to, because I'm working in a government setup, I always titrate and try to give diets which are easily available and very nutritious. Once
Yes.
these kind of foreign foods have invaded in our market, this is my personal opinion. So once all these foreign foods have started invading our market, like exotic fruits and all these kind of things, they have tried to put down our Indian foods, which are much, much better than these kind of foods. Other thing is, Indian foods are catered according to our genetics, our genes, and our digestive system, our enzymes, and our environment. So being in a tropical country in Tamil Nadu down south with such a high temperature, having curd rice is very feasible for me. It is easily digestible. Why would I opt for an oats? Okay, so this is entirely my
I have
personal.
just one question.
Yes.
A lot of people are having, this lactose intolerance.
Yes.
And it has developed after, like, my children. I have one a son in Australia and a daughter in the US. Both of them have developed lactose intolerance after moving to wherever they are now. But when they come back to India to visit and we eat a normal diet, they are not affected.
Yes.
What do you?
I think the reason, again, that's what I mentioned. Your genes, see, whatever we are our genes. We have our genetic makeup. So our genes will determine the type of enzymes our body produces and the amount of enzyme in our stomach. And we generally, you see, we will be more prone to tolerate what our ancestors ate. So once you shift from this country, you go to an entirely new country, there the environment changes, the soil changes, the fruits change, the vegetables change, the environment in which they grow changes. And of course, the type of milk. So we all know there is this type A1, A2 milk, desi cow, Jersey cow. So some reason why veganism is getting famous now is because they blame it on the cow. They said it is a Jersey cow which is causing a lot of problems. I don't know, still there is no established studies or any guidelines for allopathy to go for against all milk. Still, we advocate cow milk and we still go for it. And those who are having lactose intolerance could be the reason which you told. The reason could be change in environment and change in the milk.
Thank you. Thank you so much.
So please have a balanced diet. A few tips I would like to say: stop watching TV when you're having food. Sometimes even I find it difficult. I'll be honest with you all. After a long day and hard day, I would like to sit with the TV and eat my food. But what happens when I watch TV and eat my food? I will lose control of what amount I'm eating and I won't chew my food properly. Can someone tell me what is the importance of chewing your food properly before swallowing it? I hope I'm not taking
It adds saliva to the food
saliva for what, sir?
for digestion.
Yes, so yes, so
It
there are
makes
some
the process
enzymes.
of digestion simpler because you already break the food into smaller particles, which will be much
Yes.
easier for digestion. And then the enzymes and other additives required for digestion are added.
Correct. Exactly. So the saliva in our mouth
And
has
another thing is it takes more time to swallow so that you get a right signal that actually you get your
Exactly.
stomach to fill at the right time.
Yes, I appreciate you, sir. This is the right answer which you are told. Absolutely, it's correct. Because the saliva has enzymes which will break down your carbohydrates in the food. So once you take time, slowly chew your food and then you swallow, it's already partly digested. One reason why there is a rise of diabetes in our country now is we don't chew it properly and we send it inside the stomach. And when it's supposed to be broken down by enzymes, it doesn't happen when you swallow it in a hurry. So that causes some amount of insulin resistance. And the other reason which I told is you have certain centers in your brain which feels kind of fulfilled when you have a good food. So that signal to the brain happens when you have your food, you cherish your food in your mouth. The other tip I would like to say is you reduce your plate size if it is possible. Reduce the plate in which you're having your food. A smaller plate, when you have quite an amount of food, you will feel you are full. So I think I've gone too much. I've taken time. I'll move fast.
Doctor, just 1 minute. Sorry
Yes.
to ask
Yeah,
this.
no problem.
There is a big confusion actually. Like people say that you resort to only 2-time meals, or as whereas on the other side, some doctors advise that actually no, you limit your food, whereas not necessary to limit the number of intakes. Which is the right thing, which will be helpful for the human?
Again, there is no particular guidelines in allopathic medicine towards your timing and taking of food. I think you are questioning about intermittent fasting. These are all now studies which are coming out. What I would like to tell is listen to your body. So if you are having a moderate weight, a good height and weight for your age, and your blood parameters are all seems to be within normal limits, you listen to your body. If you really don't feel hungry, don't have food. And it is always a good practice to reduce your food intake later in the night. So better to have your diet by 8 maximum 8 p.m. and sleep early. Because again, there is a wonderful practice our ancestors used to do. You know, they sleep in the sunset and wake up at sunrise. So in between period nowadays, because of night shift, we are all awake in the night. We are watching phone, we are watching TV, we are consuming food in the middle of the night, and that causes extra burden to our body. And one more reason why I say you finish your dinner early, because you have the enzyme for cholesterol synthesis in your that is HMG. The enzyme for cholesterol synthesis in your body, it is very active in the night. So when you do not take much of food in the night, your cholesterol will be automatically within normal limits. So whether it is 2 or 3 meal a day, it's entirely up to you. If you are, I would suggest like, otherwise you're a fit person, healthy person, you don't feel like having dinner in the night, later night, it's fine. You can just avoid it because your body will automatically adapt according to it. Your liver glycogen will start releasing after 12 hours. So morning when you get up, you can have your breakfast. Don't delay or skip your breakfast. So I would like to insist, there is another trend going on. Skipping your breakfast will cause weight loss. It doesn't happen that way. You have to have a balanced, proper breakfast every day. You have to start your day with a good breakfast because that will reduce your acidity and your stomach ulcer problems. And it will reduce your intensity to have a bigger dinner. So how many of you have noticed the day when you skip your breakfast, you'll have a very big dinner. You will have a craving for having a, binge eating in the night. But the day when you have a proper full breakfast, even night, you may feel like, no, I just like to have one chapati or maybe a soup and I'll hit the bed. So that's how our body is. So when somebody who has a good proper breakfast, the morning time, around, say, the best time to have your breakfast be 8 to 9:30, 10. Finish your breakfast by then. Have a full breakfast. Don't restrict yourself. Have a good breakfast. And that will reflect evening. You won't feel very hungry. The day when you do not have a good breakfast or you skip your breakfast is that day when you will feel like binging on your dinner. And do not take too much of coffee or tea. That will cause gastritis, ulcer problem, and it will cause insomnia. So anybody who's having tea after 6 o'clock, 7 o'clock in the night, you will definitely have difficulty falling asleep.
What is your comment about autophagy, doctor?
Yeah, autophagy is a normal autophagy, we call it, the normal tendency in our cells to destroy itself. Any sick cells or any cancer cells. So immune system will either go and attack it or it will destroy itself. So recently, a lot of articles and studies are coming that once you have some fasting, your body recovers, autophagy happens. But as of now, there is no proper established or published journals or studies. Yes, autophagy does happens when you fast. Again, sir, it depends on your lifestyle. If you are somebody who is very active, you're having a lot of meetings, schedules, travels, you cannot skip your food, no? But somebody who is moderately active, somebody who's more at home, who's a sedentary person, You can take a mild food, that's all. You don't have to eat heavy. So it is individually titled for each person.
Thank you, doctor.
Yes.
Thank you. Thanks a lot.
So next, just a quick view we'll go from now. So child health, I just told you. So top 10 health problems nowadays, excess of screen time. We all know that children are exposed. And recently I met my ophthalmologist friend. She's a specialist in retina. And I just spoke with her for a few minutes. And sadly, she was telling me a lot of children are coming now in adolescent age because of problems of screen time. Phone exposure and TV exposure has affected the retina of the child, and myopia. It causes vision problems with spectacle correction. And then when they're sitting a lot at home, they're going for obesity, not physically active. They're having unhealthy diet. We can see, I saw a child the other day in KFC. Parents are getting KFC burger and chicken for a child. I felt very sad, and the child was having Coke. So parents themselves are offering this to a child. The child will be around 8 years, that's all. And then other things which a child will undergo: child abuse, neglect, domestic violence. So these are the problems a child will undergo. So it is a duty of the parent to give a good nutrition and good diet to the child. And one point I'd like to insist here, in India, currently there is a rise of hepatitis infection, hepatitis B and hepatitis C. Can anyone tell what is the reason? Okay, so the reason is because of IV drug abuse and tattooing. So tattoo has become so rampant now. Children and college students, they're doing it for fashion sense, but unfortunately, tattooing increases the risk for hepatitis B virus infection, hepatitis C virus, and to some extent HIV too. So we should make sure, we should encourage our children, we should be supportive to them, explain to them, avoid tattooing as much as possible. I'm insisting that point again. Avoid tattooing as much as possible, because though tattoo seems to be all fashionable, it is not still under guidelines. So there is a high risk of acquiring hepatitis B or C. And just I'll change my slide now. We'll go fast. Yeah, so about pediatric health, I'll go fast. So we can see the well-being of a child is both physical, mental, and emotional. Good nutritious diet to the child and encouraging physical activity and playtime. You have to recognize all the cognitive skills and function. One problem which I'm noticing now of late is parents are exposing the children to rhymes, online rhymes, YouTube rhymes at a very young age. So that affects the speech development. And I had one child who had, one of my staff's child, who had a hearing impairment leading to speech development impairment. And the child went into an autistic spectrum. And the probable reason was the mother left the child alone with too much of, rhymes and TV time. So that can be avoided. Then you have to give adequate sleep, which helps in brain development, immune system, and overall well-being. Preventive care in children, all the necessary vaccines and all the serious health hazards, and educating the children, adolescents about sexual health, reproductive health, and giving them awareness about hepatitis virus infection, HIV infection, risks of tattooing, and high-risk behavior, peer pressure behavior like IV drug abuse, high-risk behaviors. All this, it's a duty of the parents and the teachers and the friends. Emotional well-being of the child is very important, which leads to mental health and social emotional development. Injury prevention, we know for the little children, we should be very careful that they do not get injured. Any diseases, cold, allergies, and skin conditions, and any pediatric medical emergencies. Healthy habits. So for a child, we can make them move with nature, teach them some gardening, help them to do good hand washing techniques, dental hygiene, sun protection. But in India, we have good amount of melanin in our skin. So unlike Westerners, we are not at a risk for, we are not at a higher risk for skin cancer. So we can let our children play in the sunlight, take them out. Recently I had one of doctor's child who had frequently done hand washing. She did not touch the soil. She was not let to play with friends, and she developed allergic reaction in her hands. Finally, you know how they overcame it. They gave all drugs, all sorts of ointment, medication, nothing worked. Finally, they made a walk with a barefoot on the beach sand, and that allergy came down. So see, getting exposed to your environment is very important. It's vital for developing immunity and resistance. So too much of protecting your children from the environment also is harmful. I'll just go to the next one. Okay, so coming to the big topic, mental health. So this is one of my favorite topics whenever I go to a college or anywhere, because I feel this is again being completely ignored in India. It's a lot of taboo. So there is quite an amount of prevalence and under diagnosis of mental health conditions such as depression, anxiety, bipolar disorder. So how do you know depression? How do you feel that somebody is depressed? Somebody is depressed doesn't mean they have to show all the symptoms out, but being parents or being family members or being people who are at work, we can notice them. Suddenly they'll feel a lot of sadness, they lose interest, they won't dress properly, they would not they'll go into a close circle, they will not come out. Suddenly a person who's very good at socializing will become all introvert. So these are few of the warning signs. Maybe the person is suffering from depression and they may be undergoing some personal problems or financial problems. So these are clues for depression. Why am I saying this? We will be the first person who will be even noticing depression symptoms in our friends or our workplace or our family members. If you're noticing, please take immediate help, because suicidal rate is quite high in India among young people, and Pondicherry stands first in suicidal death rates in India. Maybe it is because of over-reporting, or maybe because it's a union territory, but we do see a lot of suicidal deaths, so many. In a random duty, unfortunately, I see a lot of suicidal deaths among college students, youngsters, all within the age of 40. The methods will vary, poisoning or hanging, or it is really saddening. So the reason is there is no awareness. There is not much of awareness about mental well-being. There should be counselors in schools and colleges to pick up early diagnosis and treat the child immediately. Anxiety disorder is the other end. They become suddenly anxious, hyperactive, lack of sleep, too much of worries. All this will lead to affecting their diet. One small clue is somebody who doesn't eat properly, somebody who is already eating fine and all, who shows change in taking food, who doesn't feel hungry. That could be a early sign of a mental disturbance. So even if you are feeling suddenly like I was all fine, suddenly I'm losing interest in eating my food properly, I'm not feeling hungry, could be an organic cause, an illness in your body, or it could be more of psychological. Or you feel somebody in your family is ignoring their food pattern, they're not eating properly, they're losing weight continuously. You rule out any organic cause, but please keep in your mind, mental illness is equally severe as physical illness. Now, other part of the spectrum is bipolar disorder, when we call that extreme mood swing. Somebody will be extremely happy, suddenly they'll be jolly, and suddenly they'll go out, take you out, be happy. And suddenly the next moment you'll see they'll go into depression. It is like a wave pattern. That's why we call it as bipolar. Either they'll be at that end or they'll be in this end. If you're noticing bipolar illness, you can tell. So all this will affect the individual as well as the family. It will affect their job, it will affect the finance of the family and strain the relationships. And as I told you, what are the barriers to our mental health care? It's the first stigma, especially in India. No, even if we feel like, okay, I have some mental problem, I would like to have a counseling session. Immediately the family will, hey, what counseling session? You go, you switch off your phone, you'll be fine. Everything is because of your phone. Or the parents will tell, no, there is nothing like that. I'll give you one tight slap, your mental illness will go off. Or you get up and go and eat and sleep, you'll be fine. No, that's not the answer, please. If the child or if some family member themselves come forward and say something is bothering me, I am feeling sad, do not ignore the symptom, do not shun them away. It is a kind of gaslighting. Do not do that. Be patient and try to understand what they are saying. Because nowadays this awareness is more, but still in India we are feeling the taboo. If I go to a counselor, they will brand me as a mentally ill patient. There is nothing like that. Normal individuals, majority of the normal individuals, all of us face some kind of a mental illness at some stage of our life. It is only thing is whether you need a therapeutic help or you just need a counseling session. With that we can come back. So it doesn't mean that somebody is going to a counseling session doesn't mean they are mentally ill. This taboo has to go. The stigma has to break in our country. Lack of awareness, financial constraints, and our government of India has recently launched a mental health line, mental health care helpline. Okay, I will later share that number. You can call that helpline number toll free for any emergency. Somebody is being suicidal, somebody is having some mental illness. You can call that number for health services. You definitely, our therapies have advanced, and now we can see even schizophrenia patient is having better lifestyle with a good diagnosis and treatment. Social support. And so what I would like to say is mental health is multifaceted. It starts at a very young age. I hope many of you will even agree with me that even the schooling system is burdening for the children. It is very cumbersome, very competitive. Exams have become competitive, and we are putting a lot of pressure on the children. But that should not happen like that. We should have a multifaceted approach at even a very young age. We must diagnose. I'd like to put a point here. Any mother who is pregnant has or is undergoing any mental illness or depression has more tendency to give birth to child who is prone for depression or anxiety. So if you know somebody who had some marital problems or mental problems during their pregnancy, you can note the child will have more a tendency for developing. So focus on a child, focus on adolescents, focus on old people. Old people also have a lot of loneliness and depression. It doesn't come out. So the reason is nowadays we have moved away as a society. We are not close to our families. So as much as possible, I would like to suggest interact with the family members, put down your phone, switch off your TV, put off your laptop, keep away your job. Your job should be only in the job. Spend time with your family, your friends, and most importantly, your aged parents. Take care of your children. And it's both way around. When we care for them, they care for us. Our mental health improves. And last is about first aid response on road accidents. This is not about safety precautions like following road signals and helmet. That everybody knows. So common scenarios which I saw, I'm just sharing. So one thing is initial assessment. In India, we get perturbed when we see somebody lying in a road traffic accident. We just lift the person and throw them inside an auto and drag them to a hospital. But actual injury would have been some small injury. But during the transport, without giving enough support to the neck, the patient had undergone some fracture. So how you shift the patient, how you access the patient at the injury site is important. Airway management, breathing and circulation. This is ABC. So when you suppose, I'll give you a scenario. Suppose you're on the road and you're seeing someone just hit by a vehicle and collapsing on the road. So what do you think will be your first step to do? Can anyone answer?
We should go and check whether he is breathing or not.
Yes. So the first thing is you check for the breath, as you said, but you check for the pulse. So you have the carotid pulse in your neck. So you just put your fingers here in the neck region and feel the pulse. If the person is having pulse and if he's having breathing, yes, you can resuscitate the patient. So this basic resuscitation. So basic resuscitation or the cardiopulmonary resuscitation steps, again, it is being terribly ignored in India. In my opinion, yes.
Vanakkam, I am Sadanandam calling from Karur.
Vanakkam,
These things are to be given to the students, youngsters,
Yes.
which is not at all given to them. The present days, because I am working for them
Yes.
for the last 10 years. I have been working with Dr. M.S. Udayamurthy, Nammalwar and all.
Yes.
All this information is not given to the students. The first aid itself, from 9th standard to 12th standard, we should educate them. We should get a certificate like that. Then
Exactly.
they will do it. But that is not in your curriculum. And
Yes.
not only that, even the mental point of view, this is not in your MBBS curriculum itself. However, in our Indian this thing, mythology or whatever it is, one of the reason is going to the temple or something like that. No, these festivals, all those things are given or followed to make yourself little calm like that. That's why they have been doing it for a long time. But all those things are not given today. So
Yes.
that's a thing which you people have to tell the government, to the people, to the students. That's what I expect. But really, the students are not educated on these lines.
Exactly.
Instead, 1 + 1, 2, 2 + 2, 4. I have to study and earn immediately. Today itself, I will become a this thing, just like Ambani, he's made a lot of things to yesterday. So those things are all coming up. That's a pathetic situation now.
Yes, so somebody can actually, we can recommend it to the government to include at least CPR in the school curriculum, because this is very basic. It is terribly neglected in our country. How many of us who are attending this program know to do a CPR? We need not know advanced life support, but basic support we should do. A cardiopulmonary resuscitation will be the only method to save the patient at that site, on the roadside. So this is terribly neglected. Again, road safety is neglected in our curriculum. And then first aid, like somebody is electrocuted and on the road, what do you do? So these kind of topics, I cannot go in depth today, but these are also my field of interest. Whenever I get chance, I speak to students about it. But as you said, sir, if the curriculum, if the textbooks are these are included in the textbook, will be great help. And we do conduct demonstration sessions for college students, but not on a large scale. So actually, when somebody collapses on the road in India, we do not know to do a CPR unless they're a doctor or a paramedical staff. But CPR can be done by anybody. You can watch videos on CPR and how to manage a person who has collapsed. Bleeding control, again, as sir told, when somebody is bleeding, nobody knows how to control it. They pour water, they pour all that. That's all not needed. Just give pressure and you elevate the limb. It is as simple as that. They don't do that. They drop the limb and come with complete blood. Okay, so I had a patient who, when I was in casualty in trauma care, patient had fallen down with an accident. By the time they shifted him here, there was terrible blood loss just because they did not give enough pressure and lift the limb. So if they're just given enough, suppose I have a cut here and it is not healing. So just pressing is not enough. I have to elevate the limb so that the blood flow goes downwards and doesn't go out. It's a very simple step. And I had another patient who just had a minor injury and he had some loss of consciousness. But otherwise, there is no major. But because they shifted him in a wrong position, all the auto men who were around the public, they got so tensed, anxious. They just shifted him in an auto. They just, didn't handle him properly. And his foot was hanging out of the auto. And by the time he reached our casualty, he was having full bruises and bleeding in his legs. And another patient, similar patient, he had a spinal fracture because he was not transported properly. This is all sad. People get, apprehensive, they get anxious, but they do not do the right help. Another point I would like to add here is, if you see somebody with a fracture of a limb on the road, they have met with an accident, and you're suspecting a fracture, or you're seeing a bone out of the wound. Do not try to put the bone back in. Do not give pressure. Don't do all that. There's something called as splinting. So you take a stick or a scale or a wooden straight object, whichever is nearby. You keep it near the fracture and you tie it on the both the sides. That is called splinting techniques. So there are so many topics if I go into road safety care, but it will take a lot of time. But these are a few points I wanted to insist. And as sir told, it's my personal opinion that these kind of topics should be taught in school because these are life-saving. And immobilizing injuries, as I told you, have to immobilize the patient properly. And if you shift someone with a spinal fracture or somebody with a rib fracture, that's going to cause even more damage if you do not shift them properly. And burns management is an entirely different topic that's not covered much. You wash the area, leave it cool. And electrocution, if somebody is electrocuted, that is entirely different how you manage. And somebody with a dog bite. So these are the common emergencies we see in casualty, but sadly, people do not know how to respond. So positioning and shifting and providing accurate information to the healthcare facilities. And if possible, when you approach the doctor along with the patient, providing details, and for follow-up, it will be much useful. So first aid training, as sir told, we have to give practical training, fire management, when there is a fire outbreak, how to respond, how to handle a fire. These are very vital topics, sadly missed in our curriculum. And something
Madam,
a good
sorry
Samaritan
to
law
interrupt
is,
you.
yes,
Hello.
yes. Hello, yes,
Madam, Sadanandam again.
yes, sir.
So, about 10 years back, there was a big fire in Delhi in a multi-story building. The
Yes.
Japanese people survived while our people died. It's a matter of argument in that time, and they are trained from the students
Exactly.
lower level itself how they have to manage the fire. So these fellows just to close their windows, doors, and then put some water in the ground, and they laid down just like sleeping, So they got they are not affected. Whereas our people are panic and then going down like that and they got affected like that. So these things should be taught in the schools, sir. So that we want you to start so that we will follow and tell them, yes, doctor has told we should do it like that. We can come behind you. But who will start? If
Yes,
not you, who
from
else?
our
If
from,
not now, when? That's
no,
the
sir,
question.
from our
Thank you.
doctors association and from our doctors group, I mean doctor senior to me, not me, we do give representative letters to the government on and off, but I don't think the response is good. But individually, what I can do, what I am doing is whenever I meet students, whenever I meet college students, I try to cover here and there, because at a full stretch I cannot take a lecture, but I am personally very interested in teaching all this safety and first aid. But when I do get a chance, I do that. But individually, I do not have that much of authority, but still I will keep trying. So as you said, fire safety, how to respond in event of a fire outbreak, what are the types of fires, what are the types of fire extinguishers, how to respond, how to save yourself and others. This kind of knowledge is terribly lacking, and we need to give them. There's something called as a Good Samaritan law, which government had passed, which says that somebody who brings another injured person to the hospital, they are safe. That is the Good Samaritan law. So coming to the last topic is about my domain, blood transfusion. I will not take much time, just give me a few minutes. About voluntary blood donation. So do you know that once you one time you donate, you're going to save 3 lives? That is because with your one donation, we are going to make 3 components going to 3 different patients. Who are the people who require blood? Is in India, there is a huge need for blood for road traffic accidents, antenatal women, bleeding mothers, patients who are posted for surgery, anemic patients, cancer patients. So you can see, like, 1 out of 3 person in lifetime, they'll require blood transfusion. Every 2 seconds, there is a need for blood. And with one donation, 3 people can be saved. So you have to give a hand to those who are in serious need of blood. So as I said, pregnant women, people undergoing surgery, children, patients affected with cancers, road traffic accidents. So these are the places. And India, there is a huge gap between the actual donation and the requirement for donation. Still, we need more youngsters to come forward and donate. You can see the difference, actual need and actual people who are donating. So in India, 1 out of every 5 people refuse to donate blood because of wrong thinking. They think it is dangerous, it is not good for their health and all that. And we have voluntary blood donation day, and we celebrate it in our national programs to, create awareness. The point I would like to insist here is there is no substitute for blood, though science has advanced so much. The artificial blood is only in research phase. It's not in practice. So till then, the source of blood is another human being. So unless a person donates, we are not going to have blood. So we know 1 in 7 patients entering a hospital will need blood. So who all can donate blood? Anyone within 18 to 65 years, physically fit, minimum weight of 45 kgs, and hemoglobin should be more than 12.5. That's the points that I insisted here. You should have good blood pressure and pulse, should not be having any fever. And one can donate once in every 3 months and 4 months for females. And voluntary blood donation in a nearby bank, you can join as a voluntary donor. And on special occasions, birthday, wedding day, you can donate too. And you do not have to wait for a call. You need not give excuses. You need not be afraid. You can just go ahead and donate. So those who are also cannot donate, somebody who's feeling sick, who's on any medical illnesses, jaundice history, tattooing, risk of HIV, high risk behavior, who has recently undergone a surgery, better not to donate. So what are the general myths about blood donation? Blood donation makes me weak. Actually, once you donate, your new blood will be formed from your marrow. So actually, you will not feel weak. You will feel a little bit more fresh. I'm scared of getting infection through donation. The needle that we use, the bag we use are highly sterile single-use bags. So there is no chance of you getting any infection by donating. And women and girls cannot donate blood. That's not true. Though women have blood loss during menstrual cycle, if you have a general good health and your hemoglobin is about 12.5, you can still donate. I am too old to donate. Up to 60, if you're a first-time donor, and up to 65, if you're a regular donor, you can donate. And you can donate once in every 3 months. I'm saving it for my family needs. You can donate today, and tomorrow when somebody donates, you can get it. And nobody asked me so far for blood donation. That is a big gap on our side. We have to give more motivation and recall the donors. So we are focusing more towards voluntary blood donors because they are safer. They have no motive of money or anything. They just voluntarily come and give blood, and they will disclose any high risk behavior if we ask. And their blood is safe from HIV, hepatitis B and C. And you just have to register, get a health checkup, donate blood, take refreshment and leave. The entire process will take around 45 minutes. But the actual process of blood donation is only 5 to 8 minutes. So you have to register, get a medical checkup, give your donation, donate your blood, refresh and leave. So you have to what are the things you have to do before donating? Have good water, healthy iron rich diet, and don't take any alcohol before, any sweet foods or aspirin before blood donation. After donation, before donation, take plenty of fluids, balanced diet, adequate sleep, wear comfortable clothes, do not take alcohol. If you have any medical history, let us know. Blood donation takes 5 to 10 minutes only. This is one of the pictures of blood donors. After donation, you relax for 10 to 15 minutes. We give all the refreshments, take plenty of fluids, remove the bandage after 6 hours, and you can contact in case of any discomfort. After donation, you can drink plenty of water, take rest, call the blood bank if you're feeling sick. Do not take alcohol for the next 24 hours. Do not take the bandages off. Do not do any heavy exercise or weightlifting after blood donation. So, yes, so what are the benefits for the donor? So, it's a kind of, you get a free medical checkup. We check your BP, we check your blood, we screen your blood for HIV, hepatitis, and all the viral infections. We check it for malaria. We check your weight. So this is a free medical checkup, and you can know the process and motivate others. And there is altruistic feel. You feel good after you donate blood because you have helped someone in need. And another thing, you get to know your blood group. There are studies which tells that there is a significant decrease in blood cholesterol level when someone who donates frequently, but it is only not yet in an established phase, but still study is going on. And as I told you, whole blood is collected and separated into 3 components: red cells, platelets, and plasma. So each of this component will go for different patients. That is why when you donate once, you are saving 3 lives. Before donating, you should have an iron-rich food. Some pictures I have put about all iron-rich food, both vegetarian and non-vegetarian. Since in our country, we are majority our food will be veg, and once in a while we take non-veg. So in veg, we should take food which is rich in iron. Spinach and all these green vegetables are good source of iron. Pomegranates, beetroot. Okay, so pomegranate is a very good source. Then you have dates and all these kind of raisins, and then chicken and all meat. So every few minutes, it means a lifetime for others. These are the patients who are thanking the donors, patients and the families thanking the donors. These are the testimonies of patients who got saved by blood donors. And I just posted it here as a motivation. We can see cancer patients, patients undergoing surgery, patient who underwent an accident. They are getting saved by just 1 hour of your life. And these are few photos of regular voluntary donors. Some of them donate more than 50 times. Some of the donors come in the middle of the night and help us. And so when you donate blood, you can save lives. Tears of a mother cannot save a child, but your blood can. So donate blood, save life. Thank you. And I'd like to thank Gopi sir for giving me this opportunity. I thank all the members for listening very patiently. And I thank AABN for giving me this opportunity, this platform to fulfill my motive. And I'm taking it as a small step each day. Whenever I get an opportunity, a platform, I go ahead and I speak because I believe in awareness, in creating awareness. And my main belief is in preventive medicine rather than therapeutic part. We have to give awareness about preventive medicine, how to take care of your health and how to prevent illness rather than focusing more on getting the illness and running to the hospital, getting treated and all that. That part is there, but still preventive medicine is an equal part. And in India, we are given good diet. We already have good dietary patterns. We already have good lifestyle patterns. We can learn a lot from our ancestors. If we fit into that, if we follow that itself, I think we'll be healthy. So thank you.
Thank you very much, ma'am. Thank you very much for that excellent session, ma'am. Thank you very much. So we'll just keep the floor open for question and answers now. A few questions we'll take. Yeah, participants, you may please unmute and ask your questions, please.
And Gopi, can I go ahead and ask?
Yeah, please.
Can I be the first? Okay.
Yeah,
The
please.
question I want to ask is, I travel a lot. What are the challenges as a traveling person faces? You get only carbs or Sangeeta. Difficult to get proteinous food, fiber non-existent. I mean, what do you suggest? What is your suggestion for a traveling person? How do they manage? Food is a big challenge because you can't get salads unless you go to 5-star hotels. Our Indian food is full of carbs, sweet. Weddings also, if you go, carbs, sweets. You don't get protein at all. How do you manage?
Okay, so sir, it depends on how frequently you travel, what is your age, what is your daily calorie requirement. So you have to first, as I said, you have to have an awareness of your daily calorie requirement, your basic needs, and how you calculate for your type of life pattern. And after getting a rough picture, now it is up to us to fit our diet accordingly. Most of the hotels, most of the places where we stay, I think nowadays we get quite different options in our food platter, isn't it? We do have a lot of salads. It's a good thing I've noticed a lot of salads. Even our chickpeas, konda kadla is there everywhere. Recently, I went to a hotel. I even saw ragi puttu. So I was happy to see protein and multigrains. So if you're staying for a long time, you can maybe carry this multigrain powder with you. This is my individual suggestion. You have all this health mix multigrain powders. I'm not advocating any protein powder here because protein powders are different. And I would like to warn here, people are taking protein powder as a fashion trend nowadays, but sadly there is a rise of renal problems due to protein powder. So if you know any of your family member who's taking protein powder and going to the gym very frequently and avoiding natural foods, please warn them. They are more prone for renal problems. Recently in our nephrology department, we are seeing quite a rise of youngsters who are taking protein powder. So you can take all these chickpeas if you can, wherever you can get it in stalls. Best option is you can take this health mix with a good ragi. So in your hotel, wherever
Madam, Stay Fit has introduced millet drinks actually now.
Yes.
Packet. That's quite nice actually. It's a millet drink,
so,
50 rupees.
Yes,
this can be stored also. It can be taken along with you in the car also.
Yes.
I have enjoyed it.
Excellent suggestion, sir. Yes, because all these millets is jowar, bajra, and all these foxtail millets. So it's one good thing actually. Nowadays, how people have become more aware. We are getting navadanya dosa. We are getting modakatan dosa. It's a very good sign actually. It is. I appreciate it. I would rather eat a navadana dosa and modakatan dosa than eating oats. Because palate wise also it will be very palatable my food, so I would like to insist the point that let's not take too much of Western influence in our diet and too much getting carried away, because our allopathic guidelines, everything comes from American Association and British Association. Doesn't mean our diet they have to dominate our diet. We know our diet, we know our ancestors what they had, and we can have a moderation and balance it. As sir told, one drawback is we taking a lot of carbohydrates and sweets. We can balance it. We can reduce that and take more of millets, ragi, millets, and then these dry fruits in moderation. This pista and this badam. All these are very good for your protein as well as your brain. Walnut. I think we can carry some dry fruits too.
Thank you.
Can I ask one question? This is Raghu actually.
Yes.
Yeah. I think it is a wonderful session. Thanks again to Gopi sir for inviting you and having you. See, primarily three things. One is you touched upon the RO water. My understanding is, because I'm into water technologies, what I understand, RO water per se is not bad, but drinking the right TDS of the RO water is is what is matter, because what we normally recommend, because World Health Organization recommends anything above 500 requires RO. So as long as it's less than 500, and so what we generally recommend 100 to 250 or 200. That's when
Yes.
it's really palatable. It won't be a very bad or harsh for the taste buds. It's still drinkable. So 100 to 200 TDS, because when they were wherever places when they are above 500 TDS, definitely they have to do an RO. But only problem is our some of the standard RO. It's actually 1:10. If it is a 600, they bring it to 60, or sometimes even they bring it to 20, 10, 20, 30. That's very too low TDS. That's what is very, very harmful for the health. It becomes acidic pH. It's a very harmful for the health. That's a good point you brought up. And the second thing is, I think you were mentioning about allopathy and veganism, right? So I'm a living vegan for the last almost like 12 years now, and there is actually a group called Physicians Committee for Responsible Medicine. It's actually Chicago or Washington DC based. They do a lot of work with the US government. They are all like allopathy doctors, and they recommend, in fact, they advocate plant-based food and non-dairy based things. And also as a doctor, I recommend, I urge you to visit this website, Physicians Committee for Responsible Medicine, and you'll find how a lot of the allopathy doctors are finding the real good reason for moving towards veganism. In fact, they advocate the pharma companies to stop doing testing on animals, and they have found some innovative ways to do testing without harming the animals, rats and all those things. That's one thing. And the third point is you touched upon briefly the CPR, right? You spoke about. I think recently I read. What I read initially is UK schools, students are taught how to do CPR in schools, just in case or whenever they are in public, to help people, right? And what I read recently, Tamil Nadu government, I forgot on the exact news content, but Tamil Nadu government has doing something to promote CPR training among the public or the younger population, so that they can rescue people when they are in danger in public places. Yeah, that's about it. Thank you so much. It was a great session. Thank you.
Thank you. Thank you, sir.
Vijay Kumar, go on, Vijay Kumar.
Thanks, Dr. Diana. Very interesting session. You covered variety of topic in a short period of time. And thanks, Gopi and your team, and consistently bringing a lot of useful events. Doctor, just few my observation. Just don't take it wrong. The point number one is the Western food. Okay, it's a Western food. Like now, see, I live in UK for 20 years. Okay, it is not the Western food. The people who eating the food is more important than the food item what we eat. Okay. See, I live in UK for the last 20 years. Here people eat probably 7 o'clock they eat the food, and 8:30 they'll put the children to sleep, and also the elders will sleep. Okay. And then the rest is like now, then and everyone know. Okay, you have the time to digest food and get up very well. But India is like now is getting more into obese and diabetic because the people who are eating the food are not on the food where it is coming from. That is my point of view, which is for understanding. And number two is someone raised a point like now they feel like eating food even after eating food. There are two things. If your plate is consists of nutrients, vitamins, and minerals, you won't feel like eating food again. If your food is plate consists of only boiled cooked food, then you feel like eating again. And the other thing is what you have to understand is by mind wise, like now, is it really a food you want to eat or you want to drink water? The mind doesn't distinguish between drink, liquid, and food. So you need to be very clear, like now, whether you are really thirsty or you're hungry. So if you know that, then you don't have to eat food. Okay, this is what I want to share, doctor.
Yes, thank you.
Anyone else has a question? You may please unmute and ask quickly, please.
Yeah, I have a question regarding depression and treatment provisions as of now. Am I audible?
Yes, please.
Yeah, actually, first of all, I want to know is that this depression, is it that which is coming all of a sudden, or it's something that happens in a prolonged time manner? And regarding the treatment options also, will that be something which is treated in a long time manner and the person get cured in that way? What is the recent findings in this domain? And you said about prevention is better than cure. In this particular segment of depression and mental health, do such a thing exist, and how far it is I mean practical in this sense?
Yes. So I had already covered that wellness, the pillars of wellness. So it applies to mental illness also, mental health also. Somebody who is good physically active, who has good balanced diet, who has good sleep, will have lesser propensity for mental illness. And regarding your question for somebody to develop depression, there are studies that mental illnesses such as depression do run in families. Majority of these mental illnesses have a genetic correlation, and definitely there is a familial history of depression and suicide. Especially suicide is linked to some genetic inheritance. So somebody, a family member, like a first degree member, had committed suicide, there is a higher chances for the other family member to go towards suicide. Doesn't mean they will end their life by suicide, but that's also genetic. And the factor is depression will happen at any time, and it will be at a very slow, unrecognized pace in the life of that individual. But when that individual undergoes a sudden stress, for example like exams, or a kind of an accident, or being bedridden, sudden sad news, or loss of a family member, or being cheated by spouse, or being cheated by friends, this kind of a stress will trigger the threshold for the depression. So somebody will be having depression for quite a long time, even they won't be aware of it, but still it will be subtle, so subtle, and suddenly it gets triggered by some contributory factor, and that will aggravate the depression symptoms. And most of the times, even with these aggravated depression symptoms, it is missed in our country. Sometimes the family members notice, and still they find it as a taboo to take them to a psychiatrist, and they miss it, and finally the person ends their life. So this is one part which I wanted to tell. And the other thing is, the stress factor can be reduced by good family support, and having good time with nature, having good time for gardening, moving with the music, playing some instrument, having some pets. This all will increase your neurotransmitters in your brain, and even somebody who has depression will feel little bit relieved when they are moving around with such things which people around them. And regarding your therapy for depression, sir, whatever you asked, so therapy for depression majority comes from your counseling part for diagnosing what is the cause of depression. So whether it is depression per se, or it is a spectrum of other mental illness, what is the type of disorder, so whether it is anxiety associated or bipolar, so we have to first classify and diagnose it. And based on that, we'll start a therapy, and therapy follows along with counseling sessions. Some people do recover and come out of it. Some people may require longer time of treatment. It varies with each individual. You cannot completely answer this question because it is individualized. And that's environmental factors contribute significantly towards depression or anxiety or BPD or any kind of mental illness. And that in India now everything has become too competitive and very stressful. Practically, we are all affected actually. The moment you take your vehicle out and you go on the road, we are not able to reach peacefully where we are trying to go. So there's a lot of road rage. There's a lot of, substance abuse. For example, in our place in Pondicherry, we have a lot of substance abuse, high rate of alcohol consumption, high rate of drug abuse. So these will contribute to neuropsychiatric symptoms. A person who is already not having any symptoms, who doesn't even have any psychiatric symptoms, if he goes into substance abuse with a chronic alcoholism and drug addiction, they will manifest to a full-blown psychiatric illness. Substance abuse also matters.
Yes, sir. Murthy, sir, please go.
Yeah.
Please go.
Madam, it's very good presentation.
Thank
I
you,
would suggest, in fact, I used to know Dr. Dubey of your institute, was the director there. I suggest that, for example, the women's health, starting from a girl to the old age, you have described very beautifully. Can you put it in any newspaper as an article, the weekend article, so that many people will read that and then they'll get the benefit? One way of propagating is as a blog in either in newspaper or in some media, so that many people would like to take benefit out of your knowledge. Thank you.
Thank you for the suggestion, sir. I will look into it, and yes, I can look for some ways, maybe a YouTube video or
Yeah,
something.
yeah, exactly.
Definitely.
Yeah, YouTube video.
Thank
Good
you,
thing.
sir.
Right.
Yeah, anyone else has a question? I think we have been holding Dr. Dana for a long time. Okay, I think we are done, ma'am. Ma'am, once again, thank you
May
very
I just ask one thing, sir?
Yeah, please, Mr. Praful.
My name is Dr. Praful Agnihotri. I'm a professor. I was the director of IIM Trichy, and now I am based in Himachal Pradesh at IIM Sirmoor. It was a wonderful presentation. It was highly educative as well as informative. My request and suggestion as a director of an institute is this should be done in schools, colleges, as well as business schools. And every student must be aware of, especially the later part of it, how to give this CPR, how to save lives, how to operate in different scenarios like fire or earthquake, the basic first aid things. Okay. I'm feeling tempted to invite her to my school in Sirmoor, Himachal Pradesh, if her time permits, and orient all the students towards that. Okay. But please do, it's a great job. I felt happy that a very senior friend of mine recommended me this, and therefore I attended it. It was really wonderful. And please keep doing this good job. And you must do it at schools and college level also.
Yes,
Thank you.
sir. Thank you, sir. Thank you.
Good morning.
Hello.
As regards blood donation, you said after 60 we should give, and we can give up to 65. See, up to 60 years I was giving about 70 times. As you said, 4 times a year. But after COVID, I was infected, and then 2 years or about 3 years I didn't give. Do you suggest, already I'm 64, do you suggest me to give for another 1 year with the interval of 3 months, or what do you suggest?
Unless are you having any hypertension, diabetes, cardiac illness?
No diabetics, but little of, I'm taking Telma 80 every day.
Okay, sir. If your hypertension is under control, you can go
Yes,
for
under control.
donation. You get yourself physical check there. And if you're
Okay.
fit, you can donate up to 65 years.
So 1 more year. Nice.
Yes, you can give.
Yes. Otherwise, what you were given, the instructions or the information on the first aid, all those things, yes, it is really good. And
Thank you, sir.
we could actually recoup what we learned earlier days.
Yes, sir.
Thank you. Thank you.
Thank you.
Doctor, actually, there is always a conflict between the level of cooking and maintaining the nutrients of the food item. Actually, anyway, there is no doubt that the moment you cook, you lose some nutrients. There is no doubt at all. Actually, how to really bring out what do you call a right stage or a knowledge to the people. Most of the people are cooking it for the sake of taste at the tongue level rather than maintaining the nutrients. So whether it is traditional or even it is whatever may be the case, actually the thing is getting deteriorated now. That is the truth, actually. So how to bring out this thing, or is there any research being done in this particular area?
Yes, so there's a lot of research going on food recently, Western articles, papers, and ironically, they are focusing towards Indian diet because they feel it is very balanced and very gut friendly. Because our food has a lot of fibers, so it is easily digestible and it is more steamed and boiled kind of food. But recently, because of this hotels and all this kind of food craze, they have altered the food pattern which we are cooking and using it with too much of high flame and too much of frying, too much of barbecue. Even in my school time, I have not seen barbecue being so rampant. And you can see this shawarma type and all this burnt kind of food. This is not there in our practice. So what I would suggest is you can have our normal food, which we are already having. Try not to overcook it, because when you overcook it, you tend to lose all the vitamins. So especially these water soluble vitamins, this B complex and C, these vitamins will, when you boil it, they get lost from the food. So you try to you cook it normally. Don't overcook it and don't have to burn it or kind of do barbecue and all that.
What about ingredients like our urugai, whatever is the case, totally something which is a bacterial support for our
Yes.
gut.
Probiotics. But the problem with our pickle is it is too much salted and it has too much of oil. So if you have it in very less quantity in moderation, I think it is fine. Unless you're a diabetic or if you have a heart disease, you might as well avoid pickles and puppet, dry fish. These are the foods with exceptionally high amount of salt. So you can avoid it. And recently we had a nephrologist who came and spoke about renal health, kidney health. So they were suggesting to restrict our salt. We should not do complete restriction, but we can avoid all these salty food, processed food, packed food. So even this packed foods, this instant foods, noodles, all this have very high content of sodium. So there was a recent talk that even this Maggie, this noodles had a high amount of sodium. And the Indian Association of Nephrologists had given a recommendation letter to Nestle. And it seems they have reduced the sodium content, in that masala packet. So all these processed foods do have a high amount of sodium for preservation. We should watch the level of sodium and make it a habit to read the food labels whenever we are picking up any food, the calorie content and the sodium content and the other processed artificial sweetness, all that have to be checked. And generally, it's good to avoid all these colored foods, chicken 65 or gobi fry, anything with that too much of red color, too much of colors. It is artificial and it is not healthy.
Thank you. Wonderful talk. I am really happy to be to listen to this particular thing. Thanks, Gopi, as well as thanks, Dr. Diana.
Yes, sir.
So what is sorry, I'm Raj, sorry for joining late. I got a quick question. What is a good diet for fatty liver, madam?
Diet is the same, sir. Whatever I have told, that is the basic pattern of food we are supposed to follow. You don't have to alter it for each condition. You should have your plate. If you take your plate, like preferably, say, for example, your lunch, you should have majority of your plate be filled with fiber, which is your vegetables. And you can have either cooked vegetables or salads. I personally prefer a little bit of cooked vegetable because it's a bit easier to digest, but some people prefer salads. Then you can have some amount of protein, either chickpeas or a small amount of meat. And fish, anybody is having fish. Fish is a good source of omega-3 fatty acids. It has a lot of good benefits. And apart from that, your carbohydrate on your plate should be relatively lesser. Doesn't mean we should completely ignore carbohydrates. So there is some type of strange food practices where they completely cut carbohydrate and have only protein, only this kind of diet. It works for them. But the overall point in that is when you completely cut your carbohydrates also, it is not good because carbohydrates do have some amount of benefit in your body. It is a type of carbohydrates that you take. That's why from white rice, you can shift once in a while to wheat, or maybe unless you're gluten, if you're gluten sensitive, then your diet varies. But if you're a normal person, you can have a balanced diet, nutritious diet. It works well for fatty liver. There's nothing separate for fatty liver. Fatty liver is one manifestation of obesity.
Thank you, madam. Very good.
Thank you.
Madam, one small question. This is regarding microwave reheating.
Yes.
Is it good? I mean,
Yeah, there are some controversial papers which got published recently. Microwaving is again not good for our health. It is your individual feasibility. If you're able to heat it without microwave, it's fine, well and good. But certain countries, if you're staying in foreign countries, you have microwave and you have no other option. You have to cook it only in microwave. Then at least use it in microwave compatible vessels. That also matters. And our country, we are using a lot of plastics. And again, a recent controversial topic going on is microplastics. Plastics getting, deposited in our tissues, in our body because of consistent use of plastic water bottles, plastic spoons, plastic boxes for carrying food. So again, plastics do get mixed and come into our body. So when you microwave food in a not a good plastic, in microwave compatible container, the food will get mixed with the plastic. So it increases the microplastics in your body. So as much as possible, my personal suggestion, we can avoid. If you have other method of heating it, it's better.
Thank you, madam. And thank you, Gopi, sir.
Yeah, we can take one last question. Anybody has a question, you may please unmute and ask, please. One last question.
I think only one thing I did not hear from your thing is probably you may, if you have not included, you can add is probably detoxing. That's the only thing. Yeah.
Yes,
Thanks.
yes.
If it is possible, please share the social media handle so that we will get updated regarding the works and other thing that you are doing.
Yes, yes, sir, sure.
Thank you very much, Dr. Diana.
Thank you, sir.